My name is Dr. Kevin Coney, and I'm a dentist down here at Desert Senita Community Health Center here in Ajo, Arizona, about 39 miles north of the Mexican border. So we are pretty much on the frontier here. I graduated from Boston University Dental School, and I graduated as a National Health Service Corps Scholar, which means that the federal government paid for all the expenses of my education, with the thought that I would then come and serve in an underrepresented and underserved area for 4 years. It was 1 year for 1 year commitment. I had originally planned to get into public health dentistry and community health centers because of some experiences I had while studying archaeology in undergrad as a student at Boston University. And I spent some time with some rural Maya folk and lived with them for a few days and realized that they had very little to no access to medical or dental care down there. And it was at that moment that I decided that I'd spend the rest of my life trying to bring care to the folks that aren't able to access it. That led me to my post here in Ajo, which is fantastic. It's given me so many great opportunities to meet with so many wonderful folks here who otherwise would not actually have the opportunity to get the high quality care that I myself and the other providers here are able to render to the community. We also do a lot of outreach here at Desert Senita, and it's a good way for myself to get out into the public. We go down to the schools, we do work with the pre-K kids, we do work with the kindergartners, and we just get them excited about screenings and dental fluoride varnishes. And I have kids running up to me all the time in all parts of the town. Sometimes I have to disguise myself when I went to the supermarket because the kids run up to me and can't tell me enough how excited they are that they brushed their teeth this morning. So that means that we're all doing our job here, and it's a wonderful feeling. We get paid monetarily, of course, but we get paid in far, far, far greater amounts in the satisfaction and knowing that you've helped a population that normally wouldn't be able to get the kind of help that your training and your skills are able to provide for them. I plan on staying in some form of public health dentistry. I also am involved in mission trips to Guatemala. Once a year I'll take dental students, fourth-year dental students, down into Guatemala, and we'll treat in extremely rural conditions in areas where people have literally no access to care, in hopes that I will be able to share my experience and have an eye-opening type of situation for a student who then gets involved for their lifetime in some kind of community health center or outreach dentistry as well.